My name is Rick Greene, and it's my wonderful pleasure to host another of our video interview series highlighting our CoC chairs for the 100th commemoration of the Commission on Cancer. And today is just a treat to be talking with a longtime friend and colleague, Dr. Ed Partridge. Ed, welcome.
Good morning, Rick. Glad to be here. Thank you.
Dr. Partridge was Commission on Cancer Chair from 1996 to 1998. So, Ed, I guess I'd like to start off by asking, how did you get involved in the Commission on Cancer? What brought you to the commission?
That's really an interesting story. You know, I'm a GYN oncologist, not a surgical oncologist, and but I was active in the Alabama chapter of the American College of Surgeons and the Alabama division of the American Cancer Society, and went to 8 hospitals, a GYN oncologist in 8 hospitals in the Birmingham area. We were the only GYN oncology in the area. And the former state liaison program chair asked me to accept the role of state chair. What was interesting is I had never been a cancer liaison physician in a hospital. So I actually bypassed that step and went straight to state chairmanship of the cancer liaison program. And that's how I got started with the CoC. Sort of skipped the baby steps and went right into the leadership.
You know, they recognized how advanced you were, so that's very perspicacious on the commission's point. I think that's great. Let me ask you, and of course, I know you're a GYN oncologist. You've been a leader in the SGO and many organizations. Talk a little about the importance of member organizations in the Commission on Cancer, because again, I think that's been a strength, and you added a lot of organizations when you were chair.
You know, I think that's a huge strength of the commission. I think if we had remained just the American College of Surgeons, which is where our origin was, as I understand it, then there's no way we could have been as effective as we have been, particularly as the cancer specialties and subspecialties grew over the years, and you know, and the complementary services that are provided to cancer patients, like nutrition and physical activity and physical therapy and all of the things that a cancer patient's rehab, all the things that a patient needs. Hospice developed. You know, I remember well. Back in Jefferson County, I think it was probably 77. We had a Jefferson County Health Department called a meeting, and we were looking at this thing called hospice. You know, we hadn't really made it into the United States. It sort of started in England, and so I had the privilege of being involved in a lot of sort of first steps here in Alabama as we developed new cancer programs and services to help the cancer patient. But yeah, it's critical that we have, and we continue to expand, and that's good.
Absolutely. For many years, of course, you've been at UAB. You've been the Cancer Center Director of the Core Comprehensive Cancer Center at UAB. So talk a little about the importance of having our NCI programs as part of the accreditation of the Commission on Cancer.
Well, you know, and that's an interesting story in itself, because, you know, obviously the NCI designated cancer centers go through a rigorous review from the NCI every 5 years that covers obviously many of the components that are covered by the CoC, but not all of them. And since, you know, the NCI designated comprehensive cancer centers is where, you know, the bulk of the cancer research, both clinical and basic science, is done in the United States. And so NCI designated cancer centers really, you know, they have to be the lead because the discoveries are coming out of those institutions a year or two before they make it into the other academic centers and the community centers. So having them be part of the CoC gives us the status of being, you know, not just followers, but leaders in the development of new cancer therapies. So I think it was important that we got at least some NCI designated centers as part of the process early. And UAB was one of the earliest ones. We never balked at going through the process of accreditation from the CoC, and thought it was important then and still do. And it gives us, I think it teams us up nicely with the community-based cancer centers across the country, which do the bulk of the therapy. I mean, we, you know, NCI is certainly the leaders in terms of discovery, but the bulk of the therapy by far is done, of course, across the community, and it should be.
Well, that segues nicely because during your tenure, the American College of Surgeons Oncology Group really started, along with Sam Wells. You were chair 1996, 97. Can you talk a little about the importance of the clinical trial program in the commission, especially in GYN oncology?
You know, Rick, I've sort of, my memory's slipping a little bit in terms of, and I didn't realize that that had actually been started about the same time that we were. But I think it, again, it was something that gave the CoC and the College of Surgeons some credibility in terms of actually, you know, contributing to the scientific discovery, to understanding, you know, how we could better treat patients based on the clinical trials that were done within the system. And I think, you know, as I remember back, there were several things that, you know, were, you know, really changed the way we manage patients clinically. So really important. I mean, that's the most important thing about discoveries, is it actually makes a change in the way you treat a patient.
Well, Ed, as you well know, the American College of Surgeons was founded in 1913.
Yeah.
Well over 100 years ago, the same year that the American Cancer Society was founded. Now, the American Cancer Society has been near and dear to your heart. You were national president in 2010, 2011. Talk a little about the importance of the Cancer Society involved in CoC activities.
Well, I think it's indispensable. But I can remember, you know, Harmon Iyer was the chief medical officer at the American Cancer Society, and he was always tough, you know, in terms of making us toe the line that the society's investment in the CoC was worthwhile. And I think one of my fondest memories, really, it was actually probably before I was chair of the commission, it was back when I was running the cancer liaison program, is we formed a strong relationship between the CoC and its cancer liaison program, the local American Cancer Society, you know, at a division level in those days, and the state public health department, so-called triad, that actually, you know, with the goal that we would improve cancer control, you know, prevention and early detection in the states that we were serving, where the triads were formed, and that we would, you know, that we would begin to address cancer disparities, differences in outcomes between those that are have an education, insurance, reasonable income versus those that don't. And so, and I can remember the tough discussions back in the 90s in the American Cancer Society about whether or not we were devoting enough time and energy and resources to health disparity, to cancer disparity. That's come full circle, where almost every organization now is intentionally trying to make a difference in outcomes, improve the differences in outcomes between those that have and those that have not.
Well, your work with the Triad, and especially your work along with Dr. Harold Freeman in developing the Navigator program and those sorts of things, is just, I mean, you can see what it's led to today.
Yeah, that's probably my proudest accomplishment, really, was the work that I did over 25 years here in Alabama and the Deep South, using non-nurse, non-social workers, using lay people to navigate cancer patients through, or just people, through prevention, early detection, treatment, survivorship, and end-of-life care. And we've demonstrated in multiple research projects that we are effective in all of the areas across the continuum of cancer care. So, and we've seen the CoC adopt some of those standards, as that developed, and I think that's good.
Well, Ed, your contributions to the Commission on Cancer and to all of cancer care in this country is just incalculable. I'd like to thank you for your contributions, and I want to thank you for being part of this interview today.
Yeah, thank you, Rick.